Hi, this is Dr. Cox. I wanted to share an example of cataract surgery so that our patients at Associates in Eye Care that have surgery coming up can have a basic understanding of cataract surgery and can see the steps, if they'd like, before their operation. During cataract surgery, you are awake typically and comfortable. We've given you a little bit of anesthesia. Neither eye is blocked from vision. We have an eyelid holder in place to keep the eye open and in good position. Most people say they can see the microscope lights as well as various shapes and colors. I will ask you to look around from time to time and fixate on different things. We just added a couple drops of lidocaine to make sure that the patient stays comfortable, and now we'll add a little bit of a jelly-like substance to keep the eye formed. We make a small opening in the front of the cataract to make it so that we can have access to the cloudy part of the cataract to remove it. We want to make the opening to the cloudy cataract round and somewhere between 5 and 6 millimeters wide so that we can safely take out the cataract, but also can support the lens implant that we will put in at the end of the case. You can see here we are introducing a little bit of fluid into the eye to help free up the center of the cataract, and then add a little bit more of that jelly-like substance so that we can start to disassemble the cataract. Here we're separating the cataract into two distinct pieces that we can then remove. This is our micro vacuum that introduces fluid into the eye, but also helps gently break up and remove the cloudy pieces of the cataract. At this point, most people say that they notice swirling colors and they can sense cool water, but again, you're very comfortable. So here we're really taking our time to make sure that as we're taking out these last few pieces of the cataract, we don't damage the support system for the lens. Now that we have the cloudiest, densest parts of the cataract removed, we switch to a slightly different vacuum that takes care of these very small, wispy remnants of the cataract. After we've thoroughly cleaned the support system for the lens and we're sure it's ready, we refill the eye with that jelly-like substance, and then we introduce the lens. In this particular case, the patient has opted for a multifocal lens implant, which is inserted through that small incision in the clear part of the eye called the cornea, and it unfolds like a flower inside the eye. We use that same micro vacuum to remove the jelly from the eye as well as center the lens on the visual axis. This particular multifocal lens also has astigmatism correction built in, so we are taking care to orient the lens to help neutralize the astigmatism. Astigmatism is something that blurs your vision near and far. We're using that micro vacuum as well as this fluid at the end of the case to help center that lens right on the visual axis. You'll see here that I'm going to ask the patient to stare directly between the 3 lights in the microscope so that we can center that central ring, which is visible right here, right on the visual axis. And with that, the surgery is complete, and we will see the patient the next day in the office. Thanks for watching.